Hey everybody, welcome to All Things Health Insurance with me, Aaron Zolbrod of the Health Insurance Store. We're going to talk today about some Advantage plans and supplements and who possibly should be on supplements, who may not want to be, and so on and so forth. So stay tuned for about a 10-minute show here. And we welcome you all today. I hope everybody is staying safe, staying smart in this terrible time. We're going to get through it. And I know that Medicare and health insurance doesn't stop during these times. And we don't just want to focus on, everything, the COVID-19. We want to, life goes on. People are still turning 65. They're still retiring. People are losing their jobs and going to need health insurance. So we still need to focus on those things. But today what I want to get into is a situation we had with a client recently. So we had a newer agent who was sitting with one of his first clients. And this client had already signed up for a Medicare Advantage plan, a zero premium plan. And what he had told this agent was that he took it because he couldn't afford a supplement. He wanted one, but he couldn't afford one, which costs about $115 a month, including a Part D plan. Well, it turned out that this particular client couldn't afford not to have one. So in his mind, he's thinking, okay, $115 times 12, that's $1,400, $1,400 a year. I can't do that. However, unaware that he was looking in the eye $6,700 in bills for the year because of his medical conditions that whoever had signed him up for this plan, which we're going to talk about, didn't consider. So that's kind of the topic today that we're going to get into. But the first thing I want to do, for those of you who don't read my columns regularly or haven't ever heard this, I want to talk a little bit of the difference between about Advantage plans and supplements, because they're two totally different types of plans. So when you go on Medicare, you can do one of two things. You can take Medicare and a supplement, which is AKA Medigap, or you can go on an Advantage plan, which is an HMO or PPO. So we're going to talk about those differences, and they're huge. Supplements, again, AKA Medigap, are secondary to Medicare, and they do just what that moniker suggests, Medigap. They cover the gaps in Medicare, namely the $1,408 Part A hospital deductible and the 20% Part B doesn't pay. So for this reason, those who have supplements are responsible for very little, if any, medical bills, and they're also provided access to basically virtually every doctor in the country and then every non-VA medical hospital in the country. So, those who have supplements, if they want to go to the Mayo Clinic, the Cleveland Clinic, Johns Hopkins, MD Anderson Cancer Center, we don't have to worry about the UPMC and Highmark battle. People here in Fayette County like to cross the border into West Virginia. You can do that with supplements. When you're traveling, you're covered. And you don't pay any more money when you go to the Cleveland Clinic than if you went to your local hospital here. That would be Excella Health or Uniontown in Fayette County are the two most popular hospitals or places people go most when they, for items. A lot of people go into Pittsburgh, a lot of people go into West Virginia, but those are our local hospitals. So I want to give one example of why this can be so important. So in 2017, the end of 2017, I had a client who got a rare parasite from tainted romaine lettuce. Well, as good as our hospital systems here in Pittsburgh are, UPMC and Allegheny Health Networks, neither one of them had the technology to treat her. The only two hospitals in the country that did were the Mayo Clinic and the Cleveland Clinic. Elon Musk had donated some technology, one to each of those hospitals, and they were the only two that had a technology to treat her. She stayed in the hospital for 115 days, lived to tell about it. I touched her bill. It was $250,000. She didn't pay a penny. More importantly, she had access to that hospital. So if she'd had the most popular HMO at the time in Fayette County, she would not have been able to go to the Cleveland Clinic or the Mayo Clinic, and she'd have died. It's that simple. We just had not too long ago, 3-4 months ago, I remember there was an article in the paper about, somebody having an HMO with one of our local insurance companies, and that insurance company would not allow them to go to, I want to say it was Atlanta maybe, that had the technology they were doing some experimental medicine that might be able to help her, and her insurance company said, no, you signed a contract to take that HMO, you realize what you're getting into, and we're not going to pay for that, so be careful. Let's get back to Advantage. So now Advantage plans are totally different. Okay, these are HMOs and PPOs, and they use networks of providers. So it's not as easy as going to any doctor, any hospital you want. Now, most companies in Western Pennsylvania, with the exception of one, you can access almost every hospital or every doctor in Western Pennsylvania. It's when you get outside of Western Pennsylvania that can be some issues there. So again, these are HMOs and PPOs. They are not designed to pick up what Medicare does not. In other words, they're not designed to pick up that 20%. They're not designed to pick up that $1,408 hospital Part A hospital bill. What they do is they are designed to pay in place of Medicare. In other words, when you choose a Medicare Advantage Plan, HMO, or PPO, you are choosing to have Medicare take on a completely different role than what it was originally intended to cover 80% of your bill. What happens is, instead of Medicare doing that, Medicare is going to pay the insurance company, the private insurance company of your choice, about $800 to become your one and only insurance company. And at that time, it becomes that insurance company's responsibility to give you a health insurance plan and then pay all your bills minus your cost sharing. So with supplements, we pay little or no bills. With an Advantage plan, we're going to pay bills for virtually every service that you could possibly imagine, and some can be in the thousands of dollars. So a lot of times when I'm explaining it this way, somebody will stop me and say, well, what the heck would anybody do that for? So you're telling me I can either take a supplement and have almost all my bills paid or all my bills paid for, or I can take an Advantage plan and I'm going to have co-pays for, everything from a doctor visit to chemotherapy. Well, yes, that's true. And why people would take Advantage plans, and if you're going to take one, why you should, it's because you can get one, we mentioned this earlier, you can get one for $0 a month. Again, well, how can I get something for nothing? Remember, Medicare is paying that insurance company $800 a month. That's almost $10,000 a year. They're making a profit off that, and they're going to entice you to enroll by dangling out these low premiums, $0, plans in the $20 range, in the $40 range, to entice you to enroll, to save some money. So, those who stay healthy for a period of time and take a zero premium plan or a low dollar plan, in the $40, they can save $1,000 a year in premiums. And over a 5-year period, 7-year, 8-year period, that's $5,000, $7,000, $8,000. If you stay relatively healthy, you can save some money. That's if you stay healthy. So that's the risk of these things. So that's what you got to think of. We're going to talk about that a little bit more as the podcast goes on here. So when people want Advantage plans, when we find clients who want Advantage plans or need them, we always advise, we will not advise one single client in the year 2020 to take a plan that costs over $60. So all the plans that we recommend are going to be less than $60 to our clients in 2020. One other thing that people really like about Advantage plans too is they come with ancillary benefits like dental, vision, hearing aids, gym membership, and over-the-counter allowances. Supplements don't come with those, okay? So I kind of simplify it, and I can't take credit for this. It was kind of a good old Fayette County boy. Gosh, and this had to be years ago. I'm going to say 6, 7, 8 years ago. And this old boy came in, and I'm explaining to him, and the light kind of goes off, and he says to me, "So Aaron, what you're telling me is if I take a supplement, I pay more at the front door, but if I get sick, I don't pay anything out the back." And I looked at him and I said, "Exactly." And he said, "And if I take an Advantage plan, I pay less at the front door. And if I get sick, I'm going to pay out the back." And I just dropped my pen at that point. And I said, that is the most succinct way I've ever heard it put and easy to understand. And I told that guy, I said, unless you got that copyrighted, I'm stealing that from you. And I've said that exactly the way he said it to me 500 times in the last 5 years or so. And that's a really, really good way to put it. As far as the difference between supplements and Advantage plans. So I want to get back to this guy who said that he couldn't afford a supplement. Again, he was turning 65. He had diabetes with some complications, with circulation, and I think some maybe some retinopathy. But he had some complications, some serious complications. And I got to tell you, thank God we found him while he still was able to change his mind and move to a supplement. And we're going to talk about that here in a second. I just want to say first that, Advantage Plan HMOs can be a great value. However, there's certain people like this client, let's call him John, okay? There's certain people like John who literally should never be on them, in my opinion. So again, here's the example of why, okay? Again, he could pay, his supplement was like, it was $99, and then he got a prescription plan for another $14 or $15. So again, about $115 total. So I recommend Supplement Plan N almost 95% of the time. And the only bills people can receive when they have Supplement Plan N is $198 Part B annual deductible and 2 small copays, $20 at a primary care doctor or specialist and $50 at an emergency room. And that's it. So with Plan N, once the deductible's been met, there are no costs for any Medicare covered services like blood tests, x-rays, MRIs, CAT scans, surgeries, hospitalization, skilled nursing, chemo, other infused or injected drugs that are provided in an outpatient setting, radiation, diabetic supplies, durable medical equipment, et cetera, et cetera, et cetera. Once you pay that $198, you don't pay a penny for those things with Plan N. The only other bill you're ever going to get is $20 if you go to a doctor and $50 at the emergency room, and that's if you're not admitted. Okay, so now Advantage plans, on the other hand, have coinsurance for all of those services. And again, a few of them, those can be in the thousands of dollars. I already mentioned that. So the client I'm referring to, John, he receives an EYLEA injection as often as every 4 weeks. I guess it's something to be with his pressure in his eyes. So the copay for this injection and all other medications that are considered Part B, I just mentioned those. So almost every medication that's administered in an outpatient setting, chemo, EYLEA, which is also used for macular degeneration. We have a ton of people that get Remicade infusion. That's for severe rheumatoid arthritis and Crohn's disease. So these generally are $2,000 a pop. And the copay for all of these types of medications is 20% of the cost. And I don't care, it's no matter the HMO or PPO company or plan that you have. Paying more money for one of these HMOs or PPOs, and they range all the way to $300, by the way, which is a total waste of money. But the guy who's paying $300 for his Advantage plan is not getting a discount on that copay. So that person would pay $400 for this EYLEA injection, $400 for Remicade, $400 a pop for shot for macular degeneration. People with chemo can be $15,000 a pop. That means 20% is $3,000. Okay, so in John's case, if he'd have taken this Advantage plan and he needed 8 injections this year, which is, one every 6 weeks, he'd end up with $3,200 in bills just for those treatments alone. And so he and the bills don't stop until you reach what's called your maximum out of pocket with Advantage plans. And they range from $3,400 to $6,700. Now, he happened to take a plan that had a $6,700 max out of pocket. So he would have paid $3,200 for those treatments alone. And again, if he had any other bills, and I'm guessing he did, diabetic supplies he has to pay for, those were 20% of the cost with this plan. I'm sure he's getting tests quite often and going to the doctor if he's got this many complications. People with diabetes, their wounds don't heal as well. So who knows what other stuff. What I'm trying to say is he could have got bills in $6,700 and divide that by 12. He thought he couldn't afford a $100 premium. Divide $6,700 by 12, he's over $500 a month. So again, do you understand why I say sometimes people can't afford not to take a supplement? And in John's case, he couldn't. Again, thank God we got a hold of him. So you might be thinking now, that's no big deal. He just switched to a supplement later. Well, it doesn't work like that. So if you've had an Advantage plan, HMO or PPO, longer than 12 months, supplement companies no longer have any obligation to accept you into their plans. And that's because they're able to discriminate based on current or previous health conditions. They don't have to accept you. And a lot of people think, well, I thought Obamacare took care of that. Well, not when it comes to the Medicare supplement side. And that's because Medicare is given to anybody, regardless of your health conditions. Medicare also has a regulation that says when you turn 65 for the first time, that's the only time these companies have to accept you. You have 12 months from when you go on Medicare Part B in the first time to get on a supplement without answering any medical questions. You actually have 6 months to get on any plan you want. You have 12 months to change your mind and leave an Advantage plan and go back to a supplement. So, this is something a lot of people, again, or don't know. They think, I'll just take a zero premium Advantage plan. If I get sick, I'll go back to a supplement. Again, it doesn't work like that. I'm going to tell you right here, right now, there's not a supplement company around that would accept John with diabetes with his kind of complications. So again, keep that in mind. So this gentleman wound up on the wrong plan simply because he called the company he had insurance with before he turned 65, which is a total mistake for a lot of reasons. Number one, the employees of those companies are paid to sell you their plans. That's what they're paid to do. That's their job. I'm sure they get reviewed based on how many people did you sign up? How many applications did you process? I believe they're even on some bonuses. I know one insurance company, they are on bonuses when they work directly for the company and are doing these plans if they're enrolling people over the phone or in one of their retail locations. The other reason you want to do this is you're only getting one plan option. You're not getting them all compared side by side. So how do you know you're getting the best? We find other people. In this case, let me step back here. In this case, this person that he talked to of this company, it appears he or she didn't ask John if he had any special medical needs and advise him accordingly. Either he didn't do that, the person didn't know what they were doing to even ask those questions, or they knew and didn't, put him on the plan anyways, even though it wasn't in his best interest. The only person who has an interest in this was a person that gets compensated to provide that plan, and the company itself, possibly. And actually, this company's wouldn't make money because they're going to be paying out probably more in claims, my guess is, on this kind of person than they might be collecting. They might be collecting in that $800. I don't know, but again, you can't just get one set of advice, one piece of advice. You can't just buy a plan because it's what your neighbor has. We call that over the fence advice. Oh, I love my XYZ plan. Well, how do you know that person who has that plan doesn't get it from their employer or company they retired from? Because that often can be a lot better. I don't pay anything when I go to the doctor. Well, you could go out and sign up for that same plan, XYZ, XYZ value plan or whatever fancy name they call it. And it could be totally different than what your neighbor has because he could have been getting it from work. You got to understand there's people who have PaceNet. There's people who have VA benefits. That all has to play into this. It's not a one-size cookie-cutter approach when it comes to taking a Medicare plan. So, some of the biggest mistakes are listen to what a family or friend or member has and going, about it that way. So, another way people end up on Advantage plans without understanding the ramifications is using agents who don't sell supplements, which is quite common. I was just at an event with about 50 people in my line of work, like it was an awards event. And, I'm talking to a lot of other agents, and I was just shocked at how many of them don't sell supplements, that all they're pitching to their clients is Advantage plans, Advantage plans, Advantage plans. And again, if you roll in somebody an Advantage plan like John, if you roll somebody an Advantage plan while they have the right to go on during their only time they have a right to go on a supplement, if you did that to somebody who had insulin-dependent diabetes, if you did it to somebody who had heart disease, who had an autoimmune disorder, who had a stroke recently, had AFib, had lymphoma in the past, those are all things that a supplement company will never accept. Almost every supplement company will never accept them. So what that agent has done to somebody is they sentenced to them to a life in Advantage plans. And in John's case, every year for the rest of his life, if we wouldn't have caught him when we did, he could have paid that maximum out of pocket every single year. He was going to end up paying the minimum of about $3,500 a year out of his pocket for the rest of his life. He would never be able to get back into a supplement. And, it really bothers me that there's people running around there not taking that into consideration for the people that they're meeting with. But it's out there. So at the health insurance store, so we're brokers, okay? So we're appointed to provide plans from virtually every competitive supplement, Advantage plan, and Part D company on the market. We're going to go over the positives and negatives of both types of plans. Again, I'm not here to say nobody should have an Advantage plan. That's not the case. We've got, I think, about 9,000 Medicare clients, and we've got 3,000 of them that are on Advantage plans. So there's definitely a place for them. So, but when we go over the positives and negatives, and we're concerned with all the details of each client's individual healthcare need before we're going to determine which plan or plans are the best fit. A guy like John who walks into my office, somebody who walks into my office that has lymphoma, which is a cancer that can go into remission but never actually gets cured, I won't let them take an Advantage plan. If they came to me and they said, Aaron, I want this plan, and I don't care what you say, this is what I want, I wouldn't sell it to them. I'd say, you're not buying it from me. You can go down the street and buy it from somebody else, because I'm not going to be the one who sentences you to getting thousands of dollars in bills every year. It's not going to be me, because you're not going to yell at me and say, why did you have me do this? I wouldn't sell it, because that's what's going to happen. I meet so many people who meet that maximum out of pocket every single year. Now, again, some people in their 80s and 90s are relatively healthy. These Advantage plans are far better because we don't need to pay $300 a month for a premium for a supplement, okay? We don't need to spend $3,600 a year to get everything covered. We could take an Advantage plan that's got a $3,400 max out of pocket, and as long as, and maybe, hopefully we don't hit that $3,400 every year, and if we don't, we save some money. So it goes both ways. Again, that's what we do, is we analyze all that. So again, if you want to make an appointment for no-cost consultation or have any questions regarding Medicare, you can give us a call or visit us online. Our main office number is 724-603-3403, 724-603-3403. The website is www.getyourbestplan.com. That's getyourbestplan.com. I do a column in the Post-Gazette that runs every Friday, and now it's also running in the Trib Review every Tuesday as well on page A7. It's page A2 in the Post-Gazette. You can also catch those columns on Facebook and our website, as well as a lot of stuff's going on YouTube now as well, so you can check all that out. And it was great talking to you today, everybody. We hope that you hope that you turn back in another time, and we'll see you soon. Thanks for listening, folks. Join us again soon as we interview those on the front lines of healthcare, health insurance, Medicare, and our ongoing prescription drug crisis. My name is Aaron Zolbrod, and we look forward to helping you get your best plan at the health insurance store.